Hi, thanks for joining us again with the Nashville Fitness and Beauty Roundup. We are in our third segment with Angela Hicks, talking about other pain-related issues besides exercise that she actually gets to address with her clients. I know I have clients with rheumatoid arthritis who it could be related to the weather, whether it's really, there's a front moving in that day and all of a sudden their joints are flared out. I know there's lymphatic massage, I tripped over that one. So what kind of massage do you do, and when would you apply those kind of therapies?
Right. Well, it's very important to ask your client where they are and how they're feeling at the time that they come see you.
Okay.
So somebody with rheumatoid arthritis or somebody seeking out lymphatic drainage massage, you kind of want to get a little bit of a medical history about why they're there and what they're coming in to see you for.
Okay.
So let's talk about rheumatoid arthritis. So somebody comes in and depending on how severe their arthritis is, I want to know if they're on medication for that, if it's kind of minor, if it's only in certain joints in their body. And from there, I would probably incorporate light effleurage movement, so light effleurage strokes, which basically means a rhythmic, light, circular movement, getting blood flow, circulation in that area. One of the things that I find is pretty effective with somebody with arthritis, but minor arthritis, is doing light traction. So a little bit of light pulling in the joints. So if they have it in their fingers and they're having a little bit of inflammation, I just kind of work and manually manipulate those joints. However, it's really important to continue communication between client and therapy. So if something is hurting, definitely address that to your therapist, and I try to work slow and just kind of check in, because you don't want to encourage or aggravate the symptoms that they already have, and you don't want them to leave feeling worse than they did before they came in. However, so lymphatic massage, this is pretty much for a very specific type of person. So people, when they come in for lymphatic massage, they normally deal with edema or swelling in their system, and they usually have a compromised immune system. So with this, keeping that in mind, the type of massage I do is more circulatory massage, working from the extremities down toward the heart to kind of flush out or pump out some of those proteins in the tissue that the tissue storing. Right, it's getting trapped. So you want to push that and flush that out of their body. From a therapist standpoint, though, it's really important to kind of monitor and kind of look and see, like assess the edema, assess the swelling. So if the swelling is continuing to get worse, or if the swelling is going down, kind of the circumference of the swelling. It's also important to monitor the hardness or softness of that tissue. So that, again, is another example of something you want to communicate with your client and have them communicate with you. Another thing that's really effective for both rheumatoid arthritis and lymphatic drainage massage is research has indicated that exercise is really, really important, and probably, any sort of movement in the body, just really getting that synovial fluid, those joints just kind of active and moving. And that actually really helps with those symptoms.
It's about circulation, basically. Getting circulation through the joints in case of arthritis. Circulation through the soft tissues for lymphatic to get the lymph moving through the body. 'Cause that is like the largest fluid in our body, is it not, lymph?
Yeah, absolutely.
So if that's in trouble or swelling or getting stuck, that's a problem. It can cause a lot of pain.
Right, a lot of pain, a lot of stiffness. Your immune system starts to suffer from that as well. So
that's where we're moving stuff out.
Absolutely,
What about any other pain-related symptoms like fibromyalgia?
Yeah, fibromyalgia. Fibromyalgia is a little bit tricky. The medical community is still kind of researching that. However, I have found that people with fibromyalgia suffer on a widespread kind of altogether, their whole body just kind of suffers in pain. And what it is it's a compromise of the central nervous system. So for me as a therapist, for somebody who comes in with fibromyalgia, I find that heat is really effective for those types of clients.
That makes sense.
Yeah, so any sort of heat pack or heat therapy, hydrotherapy, hot stone massage, that's real. They just find that extremely relaxing and soothing. And basically that relaxation increases the endorphins in their body and helps them feel better. And that also limits, it helps with pain management.
Pain management. Yeah. It's not a treatment for the actual,
Correct.
if you want to call it, issue. It's just more of a managing the pain, so it's a little, they can kind of go through their day a little easier.
Yeah, so they can actually go to work and function and exist. And again, I just want to reinforce that exercise is also another key to reducing those symptoms.
Great. Wow. Can you reduce aging too?
Yes, actually I can. That's a
You
really
can
good
reduce
question.
aging? Oh, okay.
Yes,
Wow.
yeah. So I have just now started incorporating a 30-minute facelift massage in my practice.
Cool.
And basically what I do is I work on certain trigger points in your face and certain types of movement and the muscle patterns and structure to help give your face a lifting effect. I also incorporate a certain hydration product that I use in my massage that if somebody was interested in using, I could talk to them more about that later. But it's just a really short 30-minute massage, just really working to relax those muscles and getting that youthful appearance back.
Wow. So the muscles just fire off better?
Yeah, so what happens is we all have facial expressions that is totally normal, but those expressions become habitual. So you create this pattern of movement or lack of movement in your face that eventually can lead to muscle atrophy. And when that happens, your muscle kind of stiffens and shrinks, and then you create those fine lines and wrinkles, kind of a pattern of your expression or whatever. So it's really good to smile. So you have those good fine lines and wrinkles. No, but
anyway,
in the
right place.
So they're in the right place. Yeah. So, but yeah. So just knowing that, I kind of work the muscle tissue, revitalize it, bring blood flow back to the area with a couple certain techniques that I've incorporated in the facelift massage. Again, with the product, and my clients are very satisfied.
Huh.
Yeah.
That's great.
Yeah, it's wonderful.
I hadn't heard of that before.
Yeah, so it's definitely something new that I've started doing, and I've seen great results.
Wow. Well, I know I've got you here, and I need to ask you because I've been dealing with personal pain, and it is exercise related, but like a plantar fasciitis, but it's not because I've laid off running before. I've tried alternate exercise. It didn't have pounding on my foot, and I've had this fasciitis kind of off and on for a couple of years. It comes and goes, and I seem to find the most relief with work on the lower leg, rather than, you see all these treatments for the actual fascia of the foot, circulating, blood in and out, and nothing, either I hear that probably didn't work for me, or I've tried the sock and it didn't really work. So, what do you? Is there ever? I just from personal trial and error found that the lower leg work actually had more of an effect on my arch than anything else. Why would that be rather than just something that's actually happening at the foot?
Right. So your body works in a system, so one thing is activated and triggered, the other thing is then muscles. Your muscles work and is all well connected, works together. So a lot of times with people with plantar fasciitis, I look at their calf muscles, so it's called the gastroc muscles, and under that is the soleus muscle. Right. So it's right in between the calf muscles. So when you're running, if you're a runner or somebody who works out a lot, sometimes that soleus muscle will shorten because it's overworked or overused, which will then cause the Achilles tendon to shorten. So that Achilles tendon is actually found on the back of your ankle. So when that's shortened, you have a line of plantar fascia under your foot that actually pulls and reduces blood flow in the connective tissue, which also causes inflammation, which then eventually causes pain. So one of the symptoms that most people talk about when they first develop plantar fasciitis is that first step in the morning when they get out of bed. So that painful heel contact, that shooting pain down the foot. So a lot of times with people like your condition, it's really good to stretch your calf muscles. before and after a workout or a run. And from there, you can kind of keep that Achilles tendon loosened up. Another thing you can do too is take like a little golf ball or like a tennis ball or something that you can roll the bottom of your
a lacrosse
foot.
ball.
Right, lacrosse ball is just as effective. So if you roll your foot on that, and especially on the inside arch of your foot and the transverse arch, which is on the base of your foot, just really rolling that out, you can loosen that connective tissue. But you want to do the two together. You want to stretch out your calves and you want to roll out your foot. And those are good preventative measures for plantar fasciitis.
But you're saying the cause is actually coming from the Achilles probably being too tight.
Right.
Likely.
Absolutely. That's the most common reason why people have plantar fasciitis.
Right. Okay, I just need to do more calf stretching then.
Stretching.
I haven't been diligent enough.
Yeah.
Okay, well, thank you for joining us.
Absolutely. My pleasure.
Oh, and thank you for joining us for Nashville Fitness and Beauty Roundup. You can find Angela at the Lilac Center or on 21st and Sweetbriar, and we have our information at talkapolis.com as well. Thanks.
Thank you.